Hi, I'm Dr. Joe Niamtu, and we're going to talk a little bit about medications today. This is a really important part of the surgical process. And if you have a small procedure, you may have one or two medications. But if you have a larger procedure or combination of procedures, you may have 4 or 5 prescriptions. So it's really important to understand how these work. If you take your prescriptions wrong, they're not going to work. If you take them really wrong, they can make you sick. So we want to optimize this situation and make it simple. I know when you leave our office, you have a pile of prescriptions, and you go to the pharmacy and you take those home and you have a whole stack of bottles, and you may understand it perfectly, but your caregiver, the person who's taking care of you the first couple days after surgery, may not understand it. And it's not uncommon that we get a lot of calls at our office because the caregiver, nobody explained to them what medication the patient's supposed to take, at what time, and how many. So it really is very important. So number one, we need to make you understand, the patient, about the medication regimen. And number two, you have to explain it to your caregiver. So by showing them this video, that will certainly help. There's nothing more important to us than our patients and their health and welfare and surgical outcome. First medications we give are the antibiotics, and you probably got Keflex, which is also called cephalexin. That's the generic that would be on the bottle. Some patients will get clindamycin, or that is also called Cleocin. With the Keflex or the cephalexin, you're going to take 1 tablet every 6 hours, so that's 4 times a day. Now people ask, do I have to wake up in the middle of the night to take this? No, you really don't, but it's nice to get on a schedule where every 6 hours or 4 times a day kind of coincides with your normal hours. So maybe when you wake up in the morning, and then when you eat lunch, and then before you go to bed. So 1 tablet every 6 hours, and we start that the day before surgery. So we'll get some antibiotics in your body actually before the surgery, and then we ask you to take that till it's all gone. Now if you're using the clindamycin or the Cleocin, again, you're going to take 1 tablet every 6 hours. So with the antibiotics, you should put that aside or label it 1 tablet every 6 hours. Now the next important medication is the pain medicine. Now first of all, if you're not experiencing severe pain, you don't need to take pain medicine. Some people can take Tylenol or Celebrex, but we don't want you taking aspirin or any type of medicine that will increase your bleeding and cause complications. We use Percocet, which is oxycodone and acetaminophen. So that is a synthetic narcotic and Tylenol mixed in 1 pill. And basically, you're going to take 1 of those every 4 to 6 hours for pain. Now, there's some leeway there. You could really take 1 every 3 or 4 hours, or if you had to, you could take 2 every 4 hours. So some people can get by with half a pain medicine, some people can get by with 1, some people require 2. If you think that you need more than 2 every 4 hours, then you should call your doctor or your nurse to discuss this. The next medication is Valtrex. Now not everybody gets this. This is just for patients that are having laser procedures done. And this is an antiviral. And if you're having a small laser done, just your eyes, you won't need this. So this is just for your full face laser. And the Valtrex, what we're doing is we're beginning this 2 days. We're beginning it 2 days before your surgery because we want to get a level of this antiviral so you don't get a herpes type infection that some people can get. And what you're going to do is you're going to take 1 of these every 12 hours. In other words, twice a day. The easiest thing to do is take 1 in the morning when you wake up and 1 at night when you go to bed. Another drug that many of our patients get is prednisone. This is an anti-inflammatory steroid, and this helps reduce your inflammation and swelling. Now, the smaller surgeries don't get this, but many of our surgeries do. And basically, you have to take 3 of these tablets at the same time. So you get 3 tablets and drink them with some water. It's really best to have some food in your stomach when you take these. So you're going to take 3 tablets at the same time once a day, and you do that every day till they're gone, which is 5 days. And with all these medications, you want to take them till they're gone. The last medicine that we commonly prescribe is Valium or diazepam. Again, not every patient needs this. Some patients have a hard time sleeping after surgery, and so you can take usually 1 of these tablets maybe a half hour before you go to bed. If you're already taking some type of sleep aid, you might need to take 2 of these tablets. For patients that also feel jittery or very anxious after their surgery, they can actually take 1 of these tablets every 8 hours just to mellow things a bit. So it's very important that you take these medications. It's very important that you know how to take them, and it's very important that you take them in a right way. So if you're confused, look at this video again and look at the information in your post-operative pack. Nothing is more important than your health, safety, and recovery.